Good afternoon and welcome to the first Headliners Luncheon event of the year. We still got people up in the front. Our special guests, we'll get them seated in the front. And welcome to the first Headliners event of the calendar year for the Manatee Chamber of Commerce. It is great to see so many members starting the new year with the Chamber. We certainly are very mindful of the effects of COVID and the Omicron variant and people's varying risk tolerance. So we are glad that you are here and that you feel comfortable attending our events. You are welcome to wear a mask if that is how you feel most comfortable. You will see our Chamber staff that way when we are not eating or drinking. We have extras at the registration table, as do we have hand sanitizers for that good hand hygiene. I know Dr. Jennifer Bensey with the Florida Department of Health in Manatee County is here, and I take my cues from Dr. Bensey. So with that, if you could please silence your mobile phones so that we don't have interruptions as we proceed with our program this afternoon, and we have a great one, as you all know in signing up. And not only that, but we are well into the full calendar year in scheduling our future headliners speakers, so we look forward to sharing a sneak peek of that with you at the end of our program today, because I know many of you are frequent flyers with us for this very important monthly membership gathering that we host. If you could please stand now and join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you so much. And as you're getting seated, we will recognize the elected officials that we expected to have with us today from the Manatee County Commission. I see Commissioners Misty Servia and Carol Whitmore. Thank you so much for your service. We expect to have Commissioners George Cruz and Vanessa Baugh joining us as well. And representing Representative Tommy Gregory's office, we have Carol Calenda with us as well. Carol in the back. Thank you so much for your service, and I know Carol, especially for Representative Gregory and those in our state delegation representing the Manatee-Sarasota region. It is a big week this week with the start of the Florida session, and we are grateful to the open lines of communication that we have in Tallahassee, as the next 60-plus days are a furious race to developing policy for the state of Florida. Now I would like you all to please also humor me, if we want to look at it that way. If you work within the healthcare industry, would you please stand now to be recognized? Don't be shy. Please, if you are in the healthcare industry, thank you so much. You and your colleagues, not just here in the community, but across the globe, are true heroes in every sense of the word. And nothing about the last 2 years has done anything except hit that message home with all of us. We are truly grateful. We can't even begin to imagine, those of us that don't work directly in healthcare, the stresses and the pressures and the daily recommitment you all have to your professions on behalf of all of us. So thank you so much for the way that you take care of us and our families. On screen, you'll see some sponsor recognitions. As you know, we have these at every chamber undertaking, the companies that step forward to support specific programming here at the Manatee Chamber. And those organizations that sponsor our monthly Headliners events are the Mosaic Company, the Realtors Association of Sarasota Manatee, and new in 2022 is Florida Power and Light. So thank you so much for your financial support to make these events possible. And then, as always, we recognize our platinum investors in the Chairman's Circle. We have 4 levels of investment within our Chairman's Circle, and these are companies that invest even more heavily than their annual membership dues to ensure that the Chamber not just delivers on its mission, but can continue to consider new programs and events and value for your business or your nonprofit. Those are Brown & Sons Funeral Homes and Crematory, Carr Riggs Ingram, Manatee County Government, Manatee Memorial Hospital, MCR Health and All Care Options, the Mosaic Company, NDC Construction Company, the Pittsburgh Pirates and Bradenton Marauders, Raymond James and Company, Bruce Body, the Sarasota Bradenton International Airport, South State Bank, and our newest platinum investor that joined us on January 1st is IMG Academy. So new, they're not even on the banner, but hopefully, I didn't check, but I think they're on screen. So thank you so much to those platinum level investors. We will now take a break. Thank you for that. We will now take a break and allow the great staff here at the Grove to serve our lunch, and we'll be back up at the podium with our very special guests today in about 15 minutes. So enjoy the start of your lunch. We are going to go ahead and get started to welcoming our very special guests. I hope that you are enjoying your lunch. I've seen a few cookies slipped into purses and bags, so that is perfectly acceptable. Just know that. So we are excited to have CEOs from our 3 major hospitals joining us today. From battling the pandemic to bringing cutting-edge care to Manatee County to the significant capital investments that are made in facilities to serve our growing region, our local hospital network is integral to our quality of life. Consider these statistics. Healthcare spending constitutes almost 20% of our national GDP. So you can do the math, what that means for Florida. Florida has a $1.23 trillion GDP annually, which actually places us ahead of Mexico and Saudi Arabia, for those of you that are trivia buffs. So imagine what healthcare spending in Florida looks like. The healthcare and social service industry is the largest employer and has the largest payroll in the United States. According to data shared last week by the Florida Chamber Foundation, there are more than 22,000 job postings right now for nurses in the state of Florida, making it easily the career with the largest number of openings in our state. All of these factors and many more face these 3 leaders and their teams on a daily basis. Joining us today are Andy Guz of Lakewood Ranch Medical Center, Tom McDougal of Manatee Memorial Hospital, and Steve Nierman of Blake Medical Center. Andy is a familiar face for most of us, having been here for a number of years in the greater Manatee County region, but Tom and Steve are somewhat new to our region, having joined us in the last year. So gentlemen, welcome. We'll be utilizing a panel format, so we will have opening remarks from each of them here from the podium, and then once their presentations are concluded, we will then open it up, most importantly, for Q&A with all of you, and I will come back up to help facilitate that. I will introduce all 3 now so that I'm not interrupting in between every presentation, so I will go from your left to right here. Andy Guz has been the CEO of Lakewood Ranch Medical Center since 2016. Before joining Lakewood Ranch, he served as the CEO of Jennersville Regional Hospital in West Grove, Pennsylvania. Andy holds a master's degree in health administration from Cornell University. Tom McDougal was hired as the new CEO for Manatee Memorial Hospital in August of 2021. Before joining Manatee Memorial, he served as the CEO at Merit Health Biloxi in Biloxi, Mississippi. He holds a Doctor of Science degree in Healthcare Management and a Master's degree in Healthcare Administration and Business Administration from the University of Alabama, so we will be extra kind to him today. Steve Nierman joined Go SEC. That's all. I was rooting for both teams as a Florida Gator myself. Go SEC. Steve Nierman joined the team at Blake Medical Center as CEO and president in September of 2021. Before moving to Bradenton, Steve was the president of the Winter Haven Hospital and the Polk Market lead for Baycare Health System in Central Florida. He has a master's degree in aeronautical science from Embry-Riddle Aeronautical University and a master's degree in business administration from Xavier University. So with that, Andy, you will start up first here at the mic. Please give a round of applause for our panel.
Thank you. Good afternoon. All right, so we got the slide. I don't have the clicker, so bear with me as we go through here. So I just wanted to give a few remarks about the spectrum of healthcare in Lakewood Ranch. I know there's going to be questions at the end, so this is a brief overview of what we have in our health system in the community. So along the left-hand side there, you'll see the three main brands that you see in the Lakewood Ranch community. Lakewood Ranch Medical Center is our 120-bed acute care general hospital. We do everything there from deliver babies to brain surgery, pretty much everything in between. The ER at Fruitville is our newest addition that opened in late 2020. That's a freestanding emergency room. So for those not familiar with a freestanding emergency room, that is exactly like walking into the emergency room of a hospital at a hospital. The only difference is that if you need to be admitted or have surgery, we transport you to the main hospital for that. But it's a way to get care out into communities that sometimes have to drive longer distances or that need emergency care services. Lakewood Ranch Medical Group's our multi-specialty physician group. It consists of primary care, general surgery, and OBGYN practices for the time, but we are continuously growing that. We're in 7 different locations within the Lakewood Ranch market right now. So within all of these entities, we have over 700 employees and are supported by 500 plus members of the medical staff. And since this is a chamber gathering, on the right there you can see some of the economic impact that, to put into perspective, the investment that we make into the community, which each year totals somewhere around $150 million all in. Next slide, please. Thank you. So these are some of the awards and recognitions that our organization has been honored with over the past few years, both locally and nationally. We strive to practice at the top of our profession. So in doing so, we apply for some of the most rigorous certifications and measure ourselves against the best practices in the industry. A few I'd like to highlight are the A safety grade that we received from Leapfrog and being awarded a top general hospital, of which we were only 46 in the entire United States. The other is the 5-star CMS rating. That's the top rating, which is given by the federal regulatory agency that administers Medicare and Medicaid services, and that was for our quality of care. And since we're eating lunch, our most exclusive and most recent recognition, which is only held by 9 hospitals in the entire country, we are a designated gluten-free safe spot. So, there's always one. There's always one. That's why I put it in there. So, we're your hospital. We're your hospital for that. Next slide, please. So how do we get to these accolades? And I wanted to share a pretty simple philosophy that we use within our culture at Lakewood Ranch, and that is, what do patients expect from us? They expect a safe environment, high-quality practices, and a great experience. Number 1 is safety, the old adage in medicine, first, do no harm. All of the safety measures must be put in place to ensure we're doing the proper procedure, giving the right dose of medicine, and providing the safest environment for everyone in the building. Second, patients expect to be healed or leave in better condition than when they came in. This is not the 1800s anymore where patients come to the hospital and say, I hope I make it out of here, right? So patients expect us to have the latest technology, technology and best practices. We know that if we treat every patient with the best known quality procedures, they have a better outcome than a place that does not do that consistently. Lastly, patients want a great experience. This is probably the hardest to convey each time because that means something different to everyone. However, the way we frame it is, be kind to me. Because the patients and their families rarely remember the exact medical treatments and procedures that were done, but they always remember how we made them feel. So we take that to heart. That's what we do. That's an overview. I try to keep it on the positive side. I'm sure there'll be lots of questions at the end, but I'd like to turn it over to Tom now. So thank you very much.
Hello. I'm sorry. I'm just going to set aside all of my remarks because we are not a gluten-free hospital. I have failed, and I didn't know it until right now. Of all the things Andy and Lakewood Ranch have accomplished, I can't believe he included that.
You got the biggest applause.
I'm so impressed. Yes, my name's Tom McDougal. Just been here for about 5 months, and Tara asked me if I'd just talk a little bit about myself personally, just because I've been here so new. I am actually tenured compared to Steve. Steve showed up a month after I did, so that's something. I've been married for 28 years. My wife is a nurse. We have 2 grown children. I say grown children. They are 21 and 25. They think they are adults. I question that. But really great kids, and so they both live in Alabama. And that is one thing I've learned in the last 36 hours. No one feels sorry for me. This is terrible. Yeah, but it's been a great run. Anyway, we've got 3 of our board members here. Carol Propsfeld, saw her back here. Thank you very much for your service. Jennifer Bensey, I thought I saw her come in. There you are. Thank you, Jennifer. And Hugh Miller, who is our board chairman, does an amazing job. I've been here for about maybe 3 or 4 weeks, and I'm not a great golfer, but I enjoy playing golf. So I go play golf with Hugh, and I go play golf with Dr. Austin Hill. And I just started playing golf again now that I've got a little bit of time to do it, that the kids are older. And I'm not very good sometimes. I hit a few shots that were not the best shots in the world, and I was a little frustrated with myself, so I'm walking back to the cart, and I just made the comment to Hugh and to Austin and said, hey guys, isn't it good news that I'm a better hospital CEO than I am a golfer? In unison, they said, we'll see. So I'm going to spend the better part of my existence in Manatee County proving I'm a better hospital CEO than I am a golfer. But I know we've got just a few moments to talk each. I was laughing because this is like torture for me or Andy or Steve that you would put a hospital CEO in front of a group of influential, powerful community members and tell us we have 8 minutes. That's brutal. I was thinking about it. It's like taking a big bag of Halloween candy and dumping it out on the floor in front of a 5-year-old little boy and saying, you can have 1 piece. That's how I feel. But I have put some information up here. We are the largest hospital in the county, have close to 2,000 employees. You can see some of our statistics up there. Just as a point of reference, we do lots of surgeries. Our ER is exceptionally busy. Almost half of the EMS runs in the county come to our facility each and every day. So we stay very busy there. Surgical cases, more than 14,000. One thing that unfortunately is a best-kept secret for our organization is we have an amazing cardiac program. It's one of the reasons that I accepted this position because of what we do with our cardiac program. MitraClip is a cardiac cath procedure that is life-changing for patients that affects the way the blood flows through the heart, and we can do it minimally invasive through the cath lab. And not only are we ranked #1 in Florida for MitraClip procedures, we are ranked 6th in the nation. And a lot of people don't know that. There's also a procedure called Watchman that helps AFib patients that have atrial fibrillation, that they don't have to continue to take medication for the rest of their lives. They can have this small implant that's put next to the heart, and this is called a Watchman procedure. We are number 14 in the nation for that procedure. So we've got an amazing program. We have 4 cath labs that run all the time. We do, on a normal basis, we'll do 35 or 40 caths a day. It's exceptionally busy. We also have a lot of locations throughout the community with our diagnostic imaging centers. We also have a lot of primary care and specialty offices. And our most exciting announcement that we made just a few months ago is, to Andy's comments, he introduced the concept of the freestanding emergency department. We will be opening our first freestanding emergency department in Sun City Center. And I was told yesterday in about 6 weeks we'll be done with construction. So another 6 weeks after that, we'll be ready for our first patients. So that's very exciting for us also. We also do a lot of investment in the community. We're kind of the safety net hospital for the community. We take care of a lot of patients that don't have the ability to pay. More than $200 million a year we end up giving away in free care, and that makes us very dependent on each of you to support us, to give us the opportunity to provide all of that free care to our community, and I thank you for that. But it's exceptionally important to us. We also pay over $14 million a year in taxes, and we have invested more than $26 million in our community and our services in the recent years. So that's all very positive. You can see down there at the bottom the awards. There are really too many for us to list. The easiest way for me to explain this is we have just about every award possible for cardiology. I think we are out of awards we can apply for our bariatric surgery program. We do more than 150 bariatric procedures a year. We did more than 30 in the month of December. So we have a very busy weight loss program as well. But we are so honored and so thankful that each of you support our organization. We thank you for all you do. We thank you for sticking with us. When the COVID numbers started rising, really, I guess 2 years ago now, one of the things that happened was the recognition of our employees as heroes. And I smiled one time when a reporter asked me what I thought about that award, and she kind of looked at me funny, and I said, I apologize that I'm smiling about that because I don't want that to be misunderstood. I said, but it just makes me really happy when the community recognizes our employees as heroes because I already knew that. And so thank you so much. If you see a healthcare worker, please do what was just done a moment ago by Jackie. Please thank them. It is a tiring time, but they're masterful in what they do, and I'm just so impressed with their professionalism. So thank you so much. I really appreciate your time today.
Which microphone is it? Both? Probably. It's probably both. Well, thank you for allowing me to come and talk to you as well. My name is Steve Nierman, and I've been at Blake Medical Center for about 3 months, but it's been from the fire hose. I've met a lot of people and learned a lot. And when I'm out in the community, which I think is a critical part of the job, I get 3 questions, being new. One is, what motivated you to move here? The other is, tell me about your background. And then it's, do you have a family? And so being new to the community, I thought I'd spend a little bit of time on who I am. I don't like to talk about myself a lot. And then I'll talk about the hospital for a few minutes after that. So what motivated me, I've been a hospital CEO for quite a while with the same company, 14 years, but Blake Medical Center was special and different. I was at a large community hospital, been a CEO for a long time, and it wasn't what you call a tertiary care hospital. And so I'll talk about that later because that is the gem in the rough here in our community. The other part of it was I came to visit one weekend because I was only about 2 hours away near Orlando, and I was shocked. I thought, this is a tourist town because, well, beautiful beaches and this and that. But as I went around the community with Rita Smith here, looking at houses and meeting people, it's also a really tight-knit, friendly place. Everybody was kind to my wife and myself and made us feel welcome and offered to show us around. So that's what motivated me, both the type of hospital that I could come to and work at, but also the sense of community. Now, personally, those 3 questions. Number 2 is tell us about your background. What I tell my whole team at the hospital is I'm the weirdest hospital CEO you'll run into. Number 1, I'm from Indiana. Nobody's ever from Indiana, right? Oh, you are? Okay. But, rural Indiana, worked on a hog farm in the summers. We had animals, all that. Number 2, though, I was in the military for quite a while and went to the Air Force Academy, was active duty, was overseas, and I had a really weird job. I was a nuclear weapons launch officer, and you don't see many of those around. And then, number 3 is I worked for the same company for 14 years before I came here, so you don't see a lot of that either. And then the last question is, Steve, do you have a family? And I do. It's not large, but it's my wife and my son. And just 2 things that are maybe unique about that is Angie, my wife, joined our company, HCA, that owns the hospital the same day. She negotiates with insurance companies, so I appreciate what she does. And then my son, what's unique about him, he graduated high school in June. He's in college in Orlando, but his name is Blake. And so he would not believe me that there was a Blake hospital. But he came home for Christmas, And I made him come, and we stood by the sign and took a picture. And so now every type of giveaway the hospital has, I mail it to him because his name is on it. Yeah, so we can take that off the screen and put the hospital up there. So one thing that I said early on is I was motivated because I was at a large community hospital, but Blake is a tertiary referral center. And I just want to touch on that briefly, high level. Blake is a level 2 trauma center, sees over 8,000 trauma patients a year. These patients are often flown in. Trauma is a life-threatening injury, blunt force penetrating. We have 24/7 trauma surgeons in the hospital, anesthesiologists, a surgery team, and then 15-minute response from all types of specialty surgeons, head and neck, urology, you name it, neurosurgery, they're all immediately available and it's required. And so that is just exciting to me to have a community that has a hospital like that. Another unique program is a burn center. There's only 6 in the state of Florida, over 20 million people, a certified burn center. There's only 120 in the entire country. And so every day as well, we have a team of plastic surgeons who are handling some of the most severe injuries you can imagine, and they're doing microsurgery to reattach limbs and digits and whatnot. And so that's very rare as well, and I really thought that was an opportunity professionally and a special thing about Blake. The third is a comprehensive stroke center. So I was working in a stroke center, and most strokes are, you have a clot. And so there's a team of doctors that can remove a clot, but there's also a type that's hemorrhagic, meaning you have a bleed. And then you need a surgeon and a neurosurgeon, and you need them quick. And so a comprehensive stroke center is you can take care of any type of stroke, whether it's a clot or a bleed. You have a team of doctors, and they're on call, and they're ready at a moment's notice. And then the last thing is a physician teaching program. We have over 80 doctors in training at Blake that are training in internal medicine, emergency medicine, infectious disease. So that's a little bit about Blake. There's some other numbers up there that you can probably read for yourself, but I just want to thank you for welcoming me to this community. My wife and I live in Bradenton. We love it. Every weekend I got the question from a board member here, John Vita. He said, what do you like most? I said, well, obviously the friendly people, but every weekend when I don't have to go to work when it's dark and come home when it's dark, I feel like I'm on vacation because this is just such a beautiful place. So I'll sit down and stop talking, and you can start firing away the tough questions for Tom.
Thank you so much. And, one thing that struck me very early on, I've been at a couple events where 2 or all 3 of these gentlemen have been present, is, think about what other industry do you have to work so closely and so well with your competition, right? And I think you see that in their personalities, in the culture that I know that they instill within their teams is the healthcare system is a complex network, right? Many of you in the audience work for specialty centers, for higher ed, which is a critically important partner to our healthcare system as well. And so it reassures me as a chamber employee to see the relationships up here. So with that, we always save ample time at our headliners events for you as the Manatee Chamber of Commerce membership to interact with these leaders. So we do have a mic here in the center of the room. If you could line up there, that allows us to be able to capture and hear what your question is. Manatee Educational Television is here recording this as well. So I have a set of questions here as well in case y'all don't get up quite as quickly as I need you to. But we'll start with Commissioner Whitmore, our first question.
Thank you. I'm Carol Whitmore, and as you know, I'm a county commissioner. And my biggest question is, first of all, thank you for all stepping up during this pandemic. It has been very tough on all of you and all of your staff on all 3 hospitals, so we really appreciate it, as well as our EMS. My question is, how are you all making it financially with this pandemic? Because you've had to stop elective surgeries, we have nurses that are leaving and doing, contract. and you're having a higher contract. How are you guys able to maintain quality of care with this turmoil right now?
You want to jump in?
Thanks for that question. First, was it weird to be in the audience presenting to the dais as opposed to the opposite in your normal job? All right. I thought you were going to talk about masks or something. So there were a lot of different questions in there. I will say that it's a tenuous time for hospitals. Probably the biggest that you brought up was staffing, and everyone here probably shares my opinion not my opinion, the fact that we know for sure that as a country we do not have enough caregivers to care for every hospital bed that is built. That is just a fact. We saw that during the influxes of the COVID waves in different areas of the hospital, and now what we're seeing is the free market, if you will, operating as intended, I guess. But where we were just talking about this literally before we came up, is that it used to be to have a nurse or any healthcare worker in a hospital, your main competition was the hospitals around you. So if someone was paying $1 or $2 more, they were probably getting better candidates than you were getting for the job. Now our competition is literally every hospital in the United States. I have people in my hospital that are from every state in the union, same with probably Tom and with Steve, and because our nurses here have seen that there's an opportunity to go to different states and make a lot of money. I mean, we're talking about, at one point we were paying $175, $190 an hour for a nurse. Not all that goes to the nurse, there's staffing companies and things like that, but you can imagine the temptation or the opportunity for a nurse that's here that maybe doesn't have kids or doesn't have a family or doesn't need to be located in this area to go for a 13-week assignment somewhere. So we're seeing all that come to fruition. So it's a tenuous time. We do things and we make sure our quality of care is the same. The policies don't change. The way we do things aren't changing. But it is difficult where you have a lot of more new people coming in as we move forward through it. So I don't know if anybody else wants to add to that.
Well said. No, I think that's well said. Probably the other thing I would add, not to change anything Andy said, but we are essentially now in our fourth wave of COVID that has occurred since really late March of 2019. And every wave has had a different set of challenges. Hospitals have figured out how to deal with the challenges that we've been given, but each time it's been different. So you learn from the past, but at the same time you're having to make other adjustments. One thing Steve and I were just talking about before the session started is we both have, and Andy does as well, we all have the same problem on this wave we've never had before, and that's staff being out sick. I've got close to 70 employees that are home with COVID right now, and that creates a challenge when the hospital's full. So I think just the fact that every wave's been a little bit different. But Carol, I think all of us would agree that we have been so resilient with our effectiveness. We're doing reasonably well financially, and quality outcomes have not fallen, but that's a testament to the professionalism of our teams.
And I'll just say one thing briefly. You said, how do you survive? How do you manage? And in my opinion, it's because of people like you, because you're a nurse. Nurses are going to do whatever it takes. They're not going to go home. They're going to work overtime. They're going to work way beyond any expectation of workload because they care and they're motivated and they love what they do. If it had been another profession or industry, they'd probably just close down. But not when you have a team that's mostly nurses and physicians as well working under the roof of the hospital.
Thank you, Commissioner. Marcus.
Hi. Hello, can you hear me? Yep. My name is Marcus Praz. I'm the CEO of Encompass Health, so I'm on the rehab side of things. One of the things we've seen throughout the phases is people staying home, not going out, hoarding the toilet paper. If anyone needs toilet paper, by the way, my mother has a lot of toilet paper. But one of the awful things that we saw is people weren't going into the hospital for care, particularly strokes. You mentioned heart attacks. Can you speak to your experiences with that, and particularly with this current phase that we're in?
Yeah, I'll take that one first anyway. The hospital I came from was what the state called a hotspot. We had some of the worst COVID percentage of spread in the community. And we saw exactly what you're saying. And it was a shame because people were dying not because of COVID directly, but because of COVID indirectly. We track how many heart attacks come in, how many strokes come in. We track all that, and all of a sudden, COVID was there. Population didn't go anywhere. The patients weren't in the ER, weren't in the hospital, none of the hospitals. And the fact is that they were scared to go into a hospital, and they were just not getting treated. So I hope that the community is more educated, that the hospital is a safe place, especially with a vaccine. But that is actually one of the tragedies of the whole pandemic that nobody really speaks to.
And it is it's an example of what I was mentioning earlier about each wave has had a different set of challenges. In the first wave that we experienced of COVID, people were very afraid to go to the ER, and you would have these terrorizing moments where I can remember a gentleman that passed away at the hospital where I was, but he had been at home with chest pain for 3 days. And by the time he got to the hospital, it's just too late. But I can tell you, most recently, we've seen, like our hospital, we were running about 80 to 85,000 ER visits a year. We have one of the busiest ERs in a 5-county area. That backed off quite a bit to where we're in the 60 to 65,000 visits a year range, but now we're back up, and I was just looking at the numbers yesterday. We're trending that we may hit another 80,000 this year. But the visits that are not coming are lower acuity. The sick patients are coming to the ER, so that makes us feel better about the safety of those patients. But that may be an impact from COVID that all hospitals experience and deal with for decades to come.
Anything to add? Thank you. Mr. Meehan.
Gentlemen, I have a question about broadband, telehealth, and productivity in your respective institutions. The infrastructure bill that was passed, I guess this past fall, has about $65 billion, I believe, earmarked for broadband. Hopefully that'll be municipal broadband. Telehealth seems like a great productivity tool for the hospitals to employ, or it seems like it could be. The people that would use telehealth, some of them anyway, are going to also need broadband to transact over telehealth. I just wonder if you could comment to the audience here about the necessity of perhaps a municipal broadband system in Manatee County to assist your efforts in delivering telehealth to, let's say, about 50% of the people in this county who live at a very basic break-even level. And by that I mean, if they don't get their paycheck that week, they start to, lose ground financially. So I'd just like to hear what you have to say about that.
So a couple of the things. So telehealth is obviously one of the things that we're going to see a lot more of in the future. If there's any silver linings to COVID, it forced our hands in a lot of things that we may have been slower to adapt in. I can tell you that our primary care offices, we had offered telehealth visits prior to COVID. I think we did something like 10 a month. And after, I want to say 3 to 4 months into COVID, we were up to, and I don't want to misquote, but it was multiples of that, like 500 a week that we were doing. So it was something that the technology exists. Now, to your point that not a lot of people, or some people may not have access to that, what we're finding is that it's not necessarily the broadband home connections that people are lacking, but everyone does everything on their phone now. So the faster the phone network gets, the better. But I will say that the overall broadband access, obviously we could do much better as a country. I'm originally from West Virginia, not the bad parts of West Virginia that you're thinking of. I'm from the Pittsburgh area, which might be bad considering if you don't like Pittsburgh. But Anyway, that's one of the lowest ranked states in terms of percentage of population that has access to community broadband. So it's something that they're trying to do. It certainly has an implication on health, probably a lot as you dive down into the socioeconomics, the whole spectrum of that, and the bad things that happen if you just don't have enough money to live and you're living paycheck to paycheck. So I think we'd certainly be for more of the municipal-based broadband for various reasons, not just that they would have access to the telehealth.
Yeah, and, that's the community perspective, and I think Andy covered that pretty well. The hospitals has changed as well. I was at a rural hospital, large rural hospital, and we're blessed in Manatee County. You've got every type of physician specialist, I think, that there is. We didn't. And so we also saw rapid adoption for hospitals that were in areas that didn't have those doctors. They were using broadband and telemedicine to get an infectious disease doctor to see the patient, or a neurologist, or a psychiatrist. It really hadn't been done before. And so that's helping the hospitals as well, using that technology to treat and make decisions around patients.
Yeah, I have to tell a story on myself because we do use a lot of telemedicine in the hospital for various services. We think about it as just a patient sitting at home that's connecting with a physician in the office somewhere, but a lot of it is also hospital-based. And I was looking at a data report that was talking about our use of technology to access our pulmonologist, our intensivist in the ICU, which is a clear quality outcome indicator, how quickly you can get patients cared for when they have a need in the ICU. And it had all of this different data on it, and it said average time for telehealth connection to the intensivist, and it said 1:00. And I was sitting in the meeting, and I said, folks, I'm really bothered by this. Why in the world is it taking us an hour to get the intensivist on the telehealth connection? And everybody looked at each other, and they looked at me, and they said, Tom, that's 1 minute. So we do use a lot of it. The most important thing for telehealth to be impactful in our industry is insurance parity. The day that insurance companies will pay a physician for a telehealth visit the same as they pay for an in-office visit, the world changes. But we're not there yet. So the broadband is important. I think that technology is essential, but we really need the insurance companies to step up.
Thank you. Bruce.
Thank you for being here today, gentlemen. My name's Bruce Lepke. Live here in Lakewood Ranch, right across from Andy's hospital. My company does a lot of engineering design for healthcare groups. About 90% of our work is in the healthcare marketplace. I'm sure it's no secret to all of you that without the CON, there is a lot of movement that's going on right now, and a lot of entities are spreading their footprints. How has that, or has it, changed the focus of your mission? Are you looking at further expansions yourself, and how are you planning on managing that movement that's going on in the healthcare marketplace?
I think that's an excellent question. The change in the Certificate of Need regulations did open things up for hospitals to be more nimble. Steve, would you mind telling us all the things you're planning on doing in the next 3 years? No?
I have to kill you.
I'll give a perfect example of how that's been impactful. Our freestanding emergency department in Sun City Center, we are probably opening it 18 months earlier than if we had to go through a Certificate of Need approval process. So that's one example of how it can be almost immediately impactful. You sure?
Yeah, I just want to say one thing, because you threw the word mission into that, and I feel strongly about this. It doesn't change your mission one bit, because your mission is to take care of patients with compassion and provide life-saving care. No matter where the competition is or how fast it comes at you, if you're focused on that, you're going to be fine.
Yeah, just the quick point that all that did was eliminate the 1 to 2 years of bureaucracy that other health systems could prevent or try to stop another health system from building more beds or a hospital or something like that. there are always business cases and demand cases, so every hospital tries to meet the demand of their community. So whether that's adding capacity, recruiting the right physicians, whatever it is. So this was really a good thing for everyone in the community, unless you're a lobbyist in Tallahassee. But other than that, it was a good thing for our community and for our state to be able to get the demand or the supply to meet the demand without all the bureaucracy that we had to go through before.
Thank you. Next, please.
Good afternoon, everyone. My name is Pedro Rosales. I'm actually Vice President for Jackfruit Land. We're a plant-based animal meat substitute product. And from a family standpoint, I have some background where we actually have a lot of issues from a health due to their actual diet. My family's diet, Spanish, we love that salt and all that good seasoning. So when it comes to the mission of our company is to actually help the actual diet in different cultures. Hospitals have a big responsibility when it comes to their inpatient diets and meal plans when it comes to different programs. And I would like to really understand what is it that you gentlemen are doing pertaining to this particular conversation.
It's a great question for a gluten-free hospital CEO.
I was going to pass it to the non-gluten friendly hospitals, but no. So I think that's a good point, and obviously as people become more health conscious and we know more about people's diets and how that affects them, genetics and all those other things, each hospital, every hospital has a dietitian or a registered dietitian and staff that all they do literally is they look at people who are in the hospital, and there are several different diets. If you've ever been in the hospital before, you know that there's liquid diets for people that can't do things or tolerate certain things. We have cardiac diets, we have no sodium diets, we have no fat diets, so we certainly are very in tune to that. Now we can't prevent what people eat or don't eat when they leave the hospital, which is sometimes why they're in the hospital, right? So, but it's certainly something that we take seriously, and we want to make sure that we're keeping people healthy. So I don't know if anybody else has. That's good.
We have two more questions.
Hello, my name is Yasmiel. I'm from the Neural Challenge Foundation for Parkinson's, and I would like to thank Lakewood Ranch and Manatee Memorial especially for working with us in partnership. I guess it's more of a comment and more of how can we help you. Our Parkinson's community, like many communities, was really largely impacted with COVID in regards to staying at home. We're unfortunately back to to video and Zoom because of the numbers, but how can we better promote their health in regards to going to the hospital and knowing that their condition is actually going to be taken into consideration? I know, for example, Lakewood Ranch and Manatee Memorial have taken part in our network, which is teaching hospitals and healthcare centers how to manage and deal with Parkinson's patients. But Sarasota itself is a big hub for Parkinson's. We hardly have any neurologists that are very well trained in Parkinson's. We are struggling with working with hospitals and medicals and OTs and PTs, and in times of COVID, it's been really, really challenging. So I guess the question would be, how can we better help you to better help our constituents?
Well, I think it's doing exactly what your mission is, and that's advocacy for the patients and education for other professionals. We greatly value what you do with us. And as you identify things in the community where there may be a gap in information or a gap in what the appropriate protocol would be, informing us and helping us to disseminate that information is absolutely the most impactful.
Thank you. And by the way, I'm going to the gluten-free hospital.
I'll add to what Tom said, because the three of us are feeling this right now, and you can help us to help people appreciate where the right place is to receive their care. Right now we're struggling. A lot of people are scared. They're coming straight to the ER with symptoms when they could be tested for COVID at a physician's site or the Department of Health or a lot of places. And the ER right now, with the capacity and the number of people, we really need to be focused on the most acutely ill patients. That's what I would add to that.
Thank you. Please.
Hello, my name is Whitney Houston. I'm with an organization called Groups Recover Together, and we do outpatient opioid use disorder treatment. And great stuff that you guys are doing. I did notice the absence of any comment about opioid, the overdose stats in 2020. Overdose deaths rose by 30%, and they were over 100,000 people dying from something that's completely preventable. So, as you can tell, I'm very passionate about it, and I would love to hear what you guys are doing, or again, maybe how we could help, but just kind of what are you doing with the opioid epidemic, because now it's within a pandemic, which has amplified it, as we've all seen. So, I've been to each of your respective institutions and, spoken with some people, but I would love to hear what you guys view that as the CEOs.
There you go. So there are a few things. So this started, and this was actually before Tom and Steve's time, but in Manatee County we had a very bad 2016, 17 years where I think, I know at Manatee Memorial, I know Tom wasn't there, but I was at Lakewood Ranch and we're sister facilities, so I know there were several times that there were 30 plus overdoses a day going into their ER. So that was something we've actually worked with the county on, the hospitals in the area, again, before their times here, but we tried to institute a no opioid in the ER, where we try to not use, sometimes people that were seeking opioids because of their disease would come in and just, they're pretty easy to spot because they would come in and they would say, I have a pain that that you can't really look at and diagnose on an x-ray or a CT, usually back pain or stomach pain, and then they were allergic to every drug except for the one they wanted. So it was that kind of thing that we were seeing, and we really worked hard with our ER providers, with the providers that are in the community, the orthopedic physicians, the primary care physicians, pain specialists, and we're really more cognizant on writing those prescriptions in the first place. You probably know this statistic, but many probably do not realize that the #1 fastest growing opioid dependent population is over 65. And that is because they go to the physician or they have a surgery and they get an opioid or a pain narcotic, and some of them are very addictive, and again, genetics or however it is that people don't have that. So we worked very hard. There's also a few more laws in Florida now where physicians can only prescribe a certain number of days of opioids or narcotics whenever a patient is in the hospital on the outpatient side. So it's worked at the state level. I don't want to say it worked, it's working at the state level, and we're doing everything we can locally here to prevent the initial stages of that, which is the exposure to opioids and narcotics, so that we don't run into these issues. But it certainly continues to be a big issue for a lot of different populations.
All right, thank you so much. Could I please have another round of applause for these fantastic healthcare leaders? Just a couple of final announcements. I promise it'll take 2 minutes or less. With today's topic of healthcare, I wanted to let you all know, because many of you will be sources of nominations, the Chamber will be reinstituting our Champions of Healthcare Awards this year. We did take a hiatus with support of our Healthcare Committee last year, but I am thrilled that we will be presenting that community-wide recognition program, the Champions of Healthcare Awards, for the 8th year in 2022. So watch for information on how you can nominate heroes within our healthcare industry for that event that will take place in June. Our 59th annual dinner and 5th annual Bart's Award event is coming up on Thursday, January 27th. If you would like to join us for that celebration of business leadership in Manatee County, we would love to have you join us at the Convention Center. Another program back now with the school district is the Chamber's annual Project Teach program. So that is the opportunity we have to send a business volunteer into every 4th grade class in Manatee County to talk with them about careers. Super fun, super hands-on, one of our most favored and beloved programs. If you haven't spent time in a 4th grade class in a long time, you will want to volunteer. We'll need about 300 of you to reach every 4th grader in Manatee County, and that will be on March 10th. So watch for information on how you and your teams can sign up, and it sounds like we will all be pushing nursing professions as we talk about careers with our young students. And then a final announcement on events is our Ship Shape Showcase. You need to say that very carefully. Our expo event that we host with our friends at Port Manatee will be coming up in April. Always a sellout. If you would like space to promote your business, please be sure to get online and get signed up now, because that will sell out likely more than a month ahead of time. So with that, once again, thank you so much for your leadership, for the most critical part of our quality of life, which is our own health and the health of our family and friends. And I am so grateful to all of you that go to work every day committed to that endeavor. With that, enjoy the rest of your afternoon, and we will see you in February. I think I skipped over, Tara, now as I'm thinking, our February Headliners event. We will have the new CEO of the Tampa Bay Partnership here to talk with us about how Bimitra Simmons and her team brings together advocacy efforts for the entire Tampa Bay region. We are thrilled she'll be joining us in Manatee County, and I believe that will be at Rosedale. So we'll see you next month, if not before. Have a great afternoon.